Changes to healthcare can impact people who are being treated for cancer.
Here to talk about that is Dr. Candace Johnson, President and CEO of Roswell Park Comprehensive Cancer Center. Dr. Johnson, thank you very much for coming in this afternoon.
My pleasure.
So this is a pretty significant change. Walk us through what will be different for some patients at Roswell.
So individuals that have independent health, individual Medicare Advantage programs, they really won't have access to Roswell Park. This was a move made by Independent Health. These sort of MA plans, as they're called, Medicare Advantage plans, are available for the past 2 or 3 years. They were low premium. They were sort of oversold, and now all these folks are, and these are people that are over 65, people with disabilities, people that have cancer. And so they are no longer going to allow them to come to Roswell Park.
We had started to hear about some of these changes, and we heard from Independent Health early on saying that these changes were coming as a result of a negotiation. So I'd like you to respond to that.
Yeah.
But I'm also curious about generally why, because I think people at home are looking and they're thinking, well, who's responsible? And I don't know if that's an easy answer, but also just why?
Well, I think why is that it really was not a negotiation. We talk and we have great relationships with Independent Health. This is only this particular plan of Independent Health. All the other plans, we have a great relationship with them, and their folks are covered. But this was not a negotiation, and what they did is they said that Roswell Park were increasing the monies that these patients will have to pay. So co-pays out of pocket.
Got it.
And we couldn't stand by and allow that, because these are folks that, you have cancer and you don't want to change your doctor. I mean, people come to us because they trust us to take care of them, and for us to just now have to charge them some exorbitant amount of money. And so, and this is happening across other insurance payers.
Yes.
But we are negotiating with them, and we're coming up with something so that the patient can afford whatever they're being shown, and they can come to Roswell Park.
Dr. Johnson, I don't know if this is a figure you have at the top of mind, but about how many patients roughly at Roswell are on a Medicare Advantage plan?
So it's about 5,500 patients. These are current patients that they're in some form of their treatment. We see about 50,000 patients, but it's still, if you're in that 5,500 group, it's a big deal. So what we're trying to do, and believe me, we will leave no patients behind. We are working with patients. We have a call line, which is that you can call 800-ROSWELL. We have a website, roswellpark.org. We're going to have people that will help you to find a plan that is going to be right for you, so you can keep Roswell and finish your treatment.
We are seeing, just like you were talking about before, the communication that has been coming from health systems over the past couple of weeks has been at least good. I think people are at least talking about this, and it certainly is making patients very nervous as well. But could this be the beginning of perhaps broader changes beyond just this Medicare Advantage plan and this situation? Could this be the start of maybe broader overhauls within the healthcare system?
Yeah, believe me, everybody that leads an organization, a healthcare organization, worries about this.
Right.
Let's hope this isn't like the first shoe to drop and there's more to come. I think that, we have an obligation to patients, regardless whether it's cancer or heart disease or diabetes, to give them the best care that they need. And so I'm an optimist, and so I think we're going to find solutions around this, and hopefully we can find a way.
All right, Dr. Candace Johnson, President and CEO of Roswell Park Comprehensive Cancer Center. Thank you so much for taking the time this afternoon.
Appreciate it.